Okay, let's talk about a disease with a really heavy history, leprosy. You might also know it as Hansen's disease. For, centuries, it was one of the most feared illnesses out there. But the thing is, while its name carries all that weight, its modern story is actually one of incredible scientific triumph.
For most of human history, people just did not get what leprosy was. And that fear, it was intense. It led to this terrible social stigma, to the isolation of anyone affected, creating this legacy of suffering that went so much deeper than the physical symptoms of the disease itself.
So, it's time to separate the myth from the medicine, right? What is the actual scientific reality behind this ancient illness today?
So, what even causes leprosy? Well, it's not a curse, it's not some kind of ancient mystery, it's a specific bacterium. So let's unmask the culprit.
All right, the culprit has a name, Mycobacterium leprae. It's a type of bacteria, and scientists call it acid-fast. That's just a term for how it looks under a special stain in the lab. But here's what's really interesting about it. It's what's called an obligate intracellular organism. That's a mouthful, I know. All it really means is that it's super needy. It literally can't survive on its own. It has to live inside our cells, which is also why you can't just grow it in a petri dish like other bacteria.
And here it is. This is what it actually looks like. Under a microscope, you can see these tiny little pinkish red rods, and they're inside human tissue. That's the microscopic enemy we're actually up against.
Now, here's a point that's absolutely crucial to understanding this disease. This bacterium is, well, it's a slowpoke, a real slowpoke. To put that into perspective, something common like E. coli can double itself in about 20 minutes. Microleprae, it takes on average 13 days to do the same thing. And that super slow growth? That's exactly why the disease has such a long incubation period, sometimes hiding out for years before any signs appear.
And this brings us to probably the biggest misconception about leprosy. It is not highly contagious. I'll say it again. You can't get it from a handshake or sitting next to someone on a bus. For it to spread, it takes prolonged, close contact with respiratory droplets from someone who has the disease and, importantly, is not being treated.
Okay, so once the bacteria gets into the body, what happens? Well, interestingly, what happens next depends entirely on your immune system. The disease is really a story of how your body decides to fight back. It's like a battleground inside you. The way leprosy shows up exists on a spectrum, and it's all dictated by how strong your immune response is. On one end of the spectrum, you've got tuberculoid leprosy. That's when your immune system puts up a really strong fight. And on the other hand, you have Lepromatous leprosy, which happens when the immune response is weak, and that lets the bacteria just multiply and spread.
So let's break down the key differences here. With tuberculoidal leprosy, that's the strong immune response, you tend to see just a few skin lesions, but you get a significant loss of feeling in those spots. With Lepromatous leprosy, the weak response, you get more widespread lesions all over, but the loss of sensation happens much more gradually. And you can really see the difference visually here. On the left, you see that single, contained, lighter patch of skin. That's classic tuberculoid. But on the right, with that weaker immune response, you get widespread bumps and thickened skin, which is sometimes called leonine, or lion-like facies. It's the exact same disease, but two totally different outcomes, all based on how the body fights it.
Okay, so we get the bacteria, and we see how it affects the body. But how do we fight back? Well, this is where the story takes a really hopeful turn, all thanks to modern medicine.
Now, before we get to the cure, we have to understand the stakes. The biggest danger from leprosy isn't actually the skin spots. It's the damage it does to the peripheral nerves. If it goes untreated, that nerve damage is permanent, and it can lead to muscle weakness and really crippling deformities, like the claw hand you see in this picture. This is exactly why getting diagnosed early is so critical.
So how do doctors diagnose it? Well, they look for three main things, the three cardinal signs, and finding just one of them is enough. First, a patch of skin that has lost feeling. Second, a nerve that's become thick enough that you can actually feel it. Or third, of course, actually finding the bacteria in a sample from the skin.
And this is the hero of our story, the game changer. Leprosy is 100% curable. And the cure is a cocktail of antibiotics called multidrug therapy, or MDT for short. And get this, since the 1980s, this life-saving treatment has been given out for free all over the world. Pretty amazing, right?
Now that multi-drug part is the key. The treatment combines a few powerful antibiotics like rifampicin, dapsone, and clofazimine.
By using them all together, they attack the bacteria from different angles, which makes sure it's killed off effectively and also prevents it from developing resistance. It is a powerful and highly effective cocktail.
But the fight doesn't just end with a pill. Curing the infection is really just step one. The second battle, and it's just as important, is preventing the disabilities it can cause and, finally, ending that centuries-old social stigma. So the modern approach looks a whole lot different. It looks like this. Community healthcare workers out there actively finding cases, making sure patients get diagnosed early, and that they complete their entire course of treatment. This is how we stop nerve damage before it becomes permanent. It's a huge shift from isolation to integration in care.
So look, if you take away just one thing from all of this, let it be this simple, powerful truth. Leprosy is curable, and with early treatment, the disabilities it used to cause are completely preventable. The challenge we face today isn't really a medical one anymore. It's about awareness, about access to care, and about finally overcoming centuries of stigma.